How to irrigate wisdom teeth cavities for optimal healing? Hello lovers of oral health. Today on our channel, we are going to delve into a topic that can literally be a toothache. How to irrigate wisdom tooth sockets for optimal healing. We know that wisdom teeth, those third molars, can be problematic and require special care after extraction. But don't worry, we've got you covered. Wisdom teeth. First of all, what are wisdom teeth? They are that last set of teeth to come in your mouth and are often a real headache. Extraction may be necessary due to problems such as impaction, pain, or simply because they do not fit in your mouth. But the important thing is that after extraction, we must provide the proper care for a recovery without complications. Why irrigate cavities? Irrigating wisdom tooth cavities is like an oral health superhero. Why? Because it plays a crucial role in preventing infection and promoting a faster recovery. After extraction, a blood clot forms at the site where the tooth existed. This clot is essential for the healing process as it protects the area and facilitates the formation of new tissue. However, food debris and bacteria can be villains, disrupting this clot and making healing more difficult, increasing the risk of infection. It's time to learn how to properly irrigate those cavities. Step 1. First of all, wash your hands thoroughly. You want to prevent germs from doing their thing in your mouth. Step 2. Fill a medical syringe or irrigation tool with sterile saline. You can also use drinking water, but we recommend a saline solution. Step 3. If you have a syringe with a needle, carefully remove the tip with scissors and bend it to direct the stream to the appropriate area. Step 4. The tip of the needle should now be about 2 millimeters from the socket. But be careful. Do not insert it into the cavity or touch the clot. If you're having trouble viewing the area, call in backup like a light or mirror. Step 5. Using gentle, controlled motions, rinse the extraction area to remove pesky food debris and bacteria. Step 6. Don't get excited. Avoid doing vigorous rinsing for the first 48 hours after the extraction. We don't want that blood clot to dislodge from its position. If you feel intense pain, excessive inflammation, or fever, do not hesitate to contact your dentist. It could be a sign that something is wrong. By following your dentist's instructions and maintaining optimal oral hygiene, you can ensure a successful recovery and minimize the risk of complications. If you found this video helpful, give us a thumbs up and don't forget to subscribe for more awesome content.
Thank you very much for what you have explained. If you have any questions about this or other topics, you can contact us at Channel Island Family Dental, as well as our Facebook page. We look forward to your visit, and we will make a timely diagnosis. Our dentists in Oxnard, Santa Pola, Ventura, Newbury Park, and Port Hueneme will be able to guide you towards the best treatment to take care of your health and give you back your best smile.